Hey, what up? Today we're learning about Chapter 7, the respiratory system. So take a deep breath. Let's get started. So, functions of the respiratory systems. The functions are to bring oxygen rich air into the body for delivery to the blood cells, expel waste products, carbon dioxide, and water that have been returned to the lungs by the blood, and produce the airflow through the larynx that makes speech possible. So, when we're talking about structures of the respiratory system, we basically have an upper and a lower respiratory tract. When you're thinking about the difference between upper and lower, just consider the upper is not protected by the ribs and the lower is protected by the ribs. The upper respiratory tract consists of the nose, mouth, pharynx, epiglottis, larynx, and trachea, and the lower respiratory tract consists of the bronchial tree and lungs. These structures are protected by the thoracic cavity. Air enters the body through the nose and passes through the nasal cavity. The nasal septum is a wall of cartilage that divides the nose into two nearly equal sections. Mucous membrane is the specialized form of epithelial tissue that lines the nose and respiratory system. Mucus, which is secreted by the mucous membranes, helps to moisten, warm, and filter the air as it enters the nose. Notice that there's different spellings. Mucus, M-U-C-O-U-S, is the name of the tissue, while mucus, M-U-C-U-S, is the secretion that flows from the tissue. Cilia, the thin hairs located just inside the nostrils, filter incoming air to remove debris. And finally, the olfactory receptors. The receptors for the sense of smell are nerve endings located in the mucous membrane in the upper part of the nasal cavity. The tonsils, which have an important function in protecting the body from invading organisms, form a protective circle around the entrance to the respiratory system. A sinus is an air-filled cavity within a bone that is lined with mucous membrane. The functions of sinuses are 1. To make the bones of the skull lighter, 2. To help produce sound by giving resonance to the voice, and 3. To produce mucus that drains into the nasal cavity. The paranasal sinuses are located in the bones of the skull. Para means near, nas means nose, and al means pertaining to. Short ducts connect these sinuses to the nasal cavity. The sinuses are named for the bones in which they are located. After passing through the nasal cavity, the air reaches the pharynx, which is commonly known as the throat. The pharynx has 3 divisions. The nasopharynx, the first division, is posterior to the nasal cavity and continues downward to behind the mouth. The oropharynx, the second division, is the portion that is visible when looking into the mouth. The oropharynx is shared by the respiratory and digestive systems. Finally, the laryngopharynx, the third division, continues downward to the openings of the esophagus and trachea. The respiratory and digestive systems share part of the pharynx. During swallowing, there is a risk of a blocked airway or pneumonia caused by something entering the lungs instead of traveling into the esophagus. 2 protective mechanisms act automatically during swallowing to ensure that only air goes into the lungs. During swallowing, the soft palate, which is the muscular posterior portion of the roof of the mouth, moves up and backward to close off the nasopharynx. This movement prevents food from going up into the nose. At the same time, the epiglottis, which is a lid-like structure located at the base of the tongue, swings downward and closes off the laryngopharynx, so food does not enter the trachea and the lungs. The larynx, also known as the voice box, is a triangular chamber located between the pharynx and the trachea. The larynx is protected and held open by a series of 9 separate cartilages. The thyroid cartilage is the largest, and its prominent projection is commonly known as the Adam's apple. The larynx contains the vocal cords. During breathing, the cords are separated to let air pass. During speech, they are together and sound is produced as air is expelled from the lungs, causing the cords to vibrate against each other. Air passes from the larynx into the trachea, which is commonly known as the windpipe. The trachea extends from the neck into the chest, directly in front of the esophagus, and is held open by a series of C-shaped cartilage rings. The wall between these rings is elastic, enabling the trachea to adjust to different body positions. The trachea divides into 2 branches called bronchi. A branch goes into each lung. Within the lung, the bronchus, if we're just talking about one of the bronchi, divides and subdivides into increasingly smaller bronchi. Bronchioles are the smallest branches of the bronchi. Because of the similarity of these branching structures to a tree, it's commonly referred to as the bronchial tree. Alveoli, also known as air sacs, are the very small grape-like clusters found at the end of each bronchiole. If we're just talking about one of the little grapes, then it's called a alveolus. The thin, flexible walls of the alveoli are surrounded by a network of microscopic pulmonary capillaries. During respiration, the gas exchange between the alveolar air and the pulmonary capillary blood occurs through the walls of the alveoli. Now let's talk about the lungs. A lobe is a division of the lungs. The right lung has 3 lobes, the superior, middle, and inferior, while the left lung has 2 lobes, the superior and inferior. The mediastinum, also known as the interpleural space, is located between the lungs. This space contains the thoracic viscera, including the heart, aorta, esophagus, trachea, bronchial tubes, and thymus gland. The pleura is a multi-layered membrane that surrounds each lung with its blood vessels and nerves. If you want to talk about plural, pleura, then you use the term pleurae. The partial pleura is the outer layer of the pleura. It lines the thoracic cavity and forms the sac containing each lung. The visceral pleura is the inner layer of pleura. It closely surrounds the lung tissue. The pleural space, also known as the pleural cavity, is the airtight space between the folds of the pleural membranes. It contains a watery lubricating fluid that prevents friction when the membranes rub together during respiration. The diaphragm is the muscle that separates the thoracic cavity from the abdomen. It is the contraction and relaxation of the muscle that makes breathing possible. The phrenic nerve stimulates the diaphragm and causes it to contract. Phren means diaphragm or mind, and ich means pertaining to. Respiration is the exchange of gases that are essential to life. This occurs in the lungs as external respiration, and on a cellular level as internal respiration. We'll begin with external first. Breathing is the act of bringing air into and out of the lungs. Inhalation, also known as inhaling, is the act of taking air in as the diaphragm contracts and pulls downward. This action causes the thoracic cavity to expand. This expansion produces a vacuum within the thoracic cavity that draws air into the lungs. Exhalation is the act of breathing out. As the diaphragm relaxes, it moves upward, causing the thoracic cavity to become narrower. This action forces air out of the lungs. As air moves in and out, there is an exchange of gases within the lungs. As air is inhaled into the alveoli, oxygen immediately passes into the surrounding capillaries and is carried by the erythrocytes to all body cells. At the same time, the waste product carbon dioxide passes from the capillaries into air spaces of the lungs to be exhaled. Internal respiration is the exchange of gases within the cells of all the body organs and tissues. In this process, oxygen passes from the bloodstream into the tissue cells. At the same time, carbon dioxide passes from the tissue cells into the bloodstream. Now, let's discuss a couple medical specialties related to the respiratory system. An otolaryngologist, also known as an otorhinolaryngologist, specializes in diagnosing and treating diseases and disorders of the ears, nose, and throat. A pulmonologist is a physician who specializes in diagnosing and treating diseases and disorders of the lungs and associated tissues. Pulmon is a word root meaning lung, and ologist means specialist. Alright, now take a deep breath because we're about to move on and discuss all of the pathologies for the respiratory system. Chronic obstructive pulmonary disease, abbreviated COPD, is a general term used to describe a group of respiratory conditions characterized by chronic airflow limitations. Asthma is a chronic allergic disorder characterized by episodes of severe breathing difficulty, coughing, and wheezing. Breathing difficulty during an asthma attack is caused by several factors. 1. Swelling and inflammation in the lining of the airways. 2. The production of thick mucus. And 3. Tightening of the muscles that surround the airways. For treatment, you need to use a bronchodilator, and we'll discuss that later under medications. Bronchostasis is a chronic dilation, enlargement of bronchi or bronchioles, resulting from an earlier lung infection that was not cured. Bronchi is a word root meaning bronchi, and ectasis means enlargement. Emphysema is the progressive loss of lung function due to a decrease in the total number of alveoli, the enlargement of the remaining alveoli, and then the progressive destruction of their walls. As the alveoli are destroyed, breathing becomes increasingly rapid, shallow, and difficult. In an effort to compensate for the loss of capacity, the lungs expand and the chest assumes an enlarged barrel shape. SRS is an abbreviation known as Smoker's Respiratory Syndrome, and it's a group of symptoms seen in smokers. These are chronic conditions that include a cough, wheezing, vocal hoarseness, pharyngitis, which is also known as a sore throat or inflamed throat, difficult breathing, and susceptibility to respiratory infections. Now let's discuss a plethora of upper respiratory diseases. Allergic rhinitis, commonly referred to as an allergy, is an allergic reaction to airborne allergens that causes an increased flow of mucus. Rhine is a word root that means nose, and itis means inflammation. Croup is an acute respiratory syndrome in children and infants characterized by obstruction of the larynx, hoarseness, and a barking cough. Diphtheria is an acute infectious disease of the throat and upper respiratory tract caused by the presence of diphtheria bacteria. Diphtheria can be prevented through immunization. Epistaxis, also known as a nosebleed, is bleeding from the nose, usually caused by an injury, excessive force, use of blood thinners, or bleeding disorders. Influenza, also known as the flu, is an acute, highly contagious viral respiratory infection spread by respiratory droplets that occurs most commonly during colder months. Some strains of influenza can be prevented by annual immunization. Pertussis, also known as whooping cough, is a contagious bacterial infection of the upper respiratory tract that is characterized by a paroxysmal cough. Paroxysmal means sudden or spasm-like. Pertussis can be prevented through immunization. Rhinorrhea, also known as a runny nose, is an excessive flow of mucus from the nose. Rhino is a word root that means nose, and rhea is a suffix that means abnormal flow. Sinusitis is an inflammation of the sinuses. Sinus meaning a word root of sinus, and itis the suffix meaning inflammation. Upper respiratory infection, URI, and acute nasopharyngitis are among the terms used to describe the common cold. Pharyngitis, also known as a sore throat, is an inflammation of the pharynx. Pharynge is a word root that means pharynx, and itis is the suffix that means inflammation. Pharyngorrhagia is the bleeding from the pharynx. Pharyngo is a word root meaning pharynx, and rhagia is the suffix that means bleeding. Pharyngorrhea is a discharge of mucus from the pharynx. Pharyngo is a word root meaning pharynx, and rhea is a suffix that means abnormal discharge. Laryngoplasia is paralysis of the larynx. Laryngo is a word root that means larynx, and plasia is a suffix that means paralysis. A laryngospasm is a sudden spasmodic closure of the larynx. Laryngo means larynx, and spasm is a suffix that means a sudden involuntary contraction. Now the next three are voice disorders. The first being aphonia, which is the loss of ability to produce normal speech sounds. The prefix a means without. Phone is a word root that means voice or sound, and ia is a suffix that means abnormal condition. Dysphonia is any voice impairment including hoarseness, weakness, or loss of voice. Dys is a prefix that means bad. Phone is a word root meaning voice or sound, and ia means abnormal condition. Finally, laryngitis is an inflammation of the larynx. Larynge is a word root that means larynx, and itis is a suffix that means inflammation. This term is commonly used to describe voice loss caused by inflammation. Now let's look at the pathology of the trachea and the bronchi. Tracheitis is an inflammation of the trachea. Trache is a word root meaning trachea, and itis is a suffix meaning inflammation. Tracheorrhagia is bleeding from the trachea. Tracheo is a word root meaning trachea, and rhagia is a suffix that means bleeding. Bronchitis is an inflammation of the bronchial walls. Bronch is a word root meaning bronchus, and itis is a suffix that means inflammation. Bronchitis is usually caused by an infection. However, it also may be caused by irritants, such as smoking. Bronchorasia is bleeding from the bronchi. Broncho is a word root meaning bronchus, and rasia is a suffix that means bleeding. And bronchiuria means an excessive discharge of mucus from the bronchi. Broncho is a word root meaning bronchus, and ria is a suffix that means abnormal flow. For pathology in the pleural cavity, we have pleurisy, which is an inflammation of the visceral and parietal pleura in the thoracic cavity. Pleuralgia is pain in the pleura, or in the side. Pleur is a word root that means pleura, and algia means pain. Pneumothorax is an accumulation of air or gas in the pleural space, causing the lung to collapse. Pneumo is a word root that means lung or air, and thorax is a suffix that means chest. This may have an external cause, such as a stab wound that perforates the chest wall. It may also be caused internally by a perforation in the pleura surrounding the lung that allowed air to leak into the pleural space. Pleural effusion is the abnormal escape of fluid into the pleural cavity that prevents the lung from fully expanding. Effusion is the escape of fluid from blood or lymphatic vessels into the tissues or a cavity. Empyema, also known as pyothorax, is an accumulation of pus in the pleural cavity. This is usually the result of a primary infection of the lungs. Empyema is also used to describe pus in other body cavities. Hemothorax is an accumulation of blood in the pleural cavity. Hemo is a word root meaning blood, and thorax is a suffix that means chest. Hemoptysis is spitting of the blood, or blood-stained sputum, derived from the lungs or bronchial tubes as a result of a pulmonary or bronchial hemorrhage. Hemo is a word root meaning blood, and peptisis means spitting. And for the pathology of the lungs, we have acute respiratory distress syndrome, abbreviated ARDS. ARDS is a type of lung failure resulting from many different disorders that cause pulmonary edema. There are many causes of ARDS, including severe infection, shock, pneumonia, burns, and injuries. Pulmonary edema is an accumulation of fluid in the lung tissues. Edema means swelling. Pneumorasia is bleeding from the lungs. Pneumo is a word root meaning lungs, and rasia means bleeding. Atelectasis, also known as collapsed lung, is a condition in which the lung fails to expand because air cannot pass beyond the bronchioles that are blocked by secretions. Atel is a word root meaning incomplete, and ectasis is a suffix that means stretching. Tuberculosis is an infectious disease caused by Mycobacterium tuberculosis. TB usually attacks the lungs. However, it can also affect other parts of the body. A healthy individual may carry TB, but not get the disease. TB is most commonly occurs when the immune system is weakened by another condition, such as an infection with human immunodeficiency virus. Multi-drug resistant tuberculosis, MDR-TB, is a dangerous form of tuberculosis because the germs have become resistant to the effect of most TB drugs. Resistance may occur if a TB infection has not been adequately treated. MDR-TB can be spread to others just as regular TB is. Pneumonia is an inflammation of the lungs in which the air sacs fill with pus and other liquid. Pneumon means lung or air, and ia is a suffix meaning abnormal condition. This fluid is known as exudate, which means accumulated fluid in a cavity that has penetrated through vessel walls into the adjoining tissue. The main causes of pneumonia are bacteria, viruses, fungi, or inhaled substances such as chemical irritants or vomit. Bacterial pneumonia, which is commonly caused by Streptococcus pneumoniae, is the only form of pneumonia that can be prevented through vaccination. Viral pneumonia accounts for approximately half of all pneumonias and may be complicated by an invasion of bacteria with all the symptoms of bacterial pneumonia. Lobar pneumonia affects one or more lobes of a lung. Bronchopneumonia is a form of pneumonia that begins in the bronchioles. Double pneumonia involves both lungs. Aspiration pneumonia may occur when a foreign substance, such as vomit, is inhaled into the lungs. As used here, aspiration means inhaling or drawing a foreign substance, such as food, into the upper respiratory tract. Aspiration also means withdrawal by suction of fluids or gases from a body cavity. Mycoplasma pneumonia, also known as mycoplasmal or walking pneumonia, is a milder but longer-lasting form of the disease caused by the fungus Mycoplasma pneumoniae. Pneumocystis carnii pneumonia, abbreviated PCP, is caused by an infection with the parasite Pneumocystis carnii. PCP is an opportunistic infection that frequently occurs when the immune system is weakened by an HIV infection. Let's also look at a handful of environmental and occupational lung diseases. Pneumoconiosis is an abnormal condition caused by dust in the lungs that usually develops after years of environmental or occupational contact. This causes cell death and fibrosis, which is hardening of the lung tissues. These disorders are named for the causative agents. Anthracosis, also known as black lung disease, is caused by coal dust in the lungs. Anthrac is a word root that means coal dust, and osis is a suffix meaning abnormal condition. Asbestosis is caused by asbestos particles in the lungs and is found in workers from the shipbuilding and construction trades. Byssinosis, also known as brown lung disease, is caused by cotton, flax, or hemp dust in the lungs. Silicosis, also known as grinder's disease, is caused by silica dust or glass in the lungs. Pulmonary fibrosis is the formation of scar tissue that replaces the pulmonary alveolar walls. Fibrosis means the abnormal formation of fibrous tissue. This condition may be caused by autoimmune disorders, infections, dust, gases, toxins, and some drugs. This destruction of lung tissue results in decreased lung capacity and increased difficulty in breathing. Idiopathic pulmonary fibrosis, abbreviated IPF, is a type of pulmonary fibrosis for which a cause cannot be identified. Idiopathic means without a known cause. Cystic fibrosis, abbreviated CF, is a genetic disorder in which the lungs are clogged with large quantities of abnormally thick mucus. Antibiotics are administered to control lung infections, and daily physical therapy, known as postural drainage, is performed to remove excess mucus from the lungs. In CF, the digestive system is also impaired by thick glue-like mucus that interferes with digestive juices. Digestive enzymes are administered to aid the digestive system. Future emergency medical responders will want to pay particular attention to these breathing disorders. Eupnea is easy or normal breathing. Eu is a prefix meaning good, and pnea is a suffix that means breathing. This is the baseline for judging some of the breathing disorders. Tachypnea is an abnormally rapid rate of respiration, usually of more than 20 breaths per minute. Tachy is a prefix meaning rapid, and pnea means breathing. Bradypnea, or bradypnea, is an abnormally slow rate of respiration, usually of less than 10 breaths per minute. Brady is a prefix meaning slow, and pnea is a suffix meaning breathing. Apnea, or apnea, is the absence of spontaneous respiration. A is a prefix meaning without, and pnea is a suffix meaning breathing. Sleep apnea syndromes, abbreviated SAS, are a group of potentially deadly disorders in which breathing repeatedly stops during sleep for long enough periods to cause a measurable decrease in blood oxygen levels. In Cheyne-Stokes respiration, abbreviated CSR, there is a pattern of alternating periods of hyperpnea, rapid breathing, hypopnea, slow breathing, and apnea, the absence of breathing. Dyspnea, also known as shortness of breath, is difficult or labored breathing. Dys is a prefix meaning painful, and pnea is a suffix meaning breathing. Hyperpnea is an abnormal increase in the depth and rate of the respiratory movements. Hyper is a prefix meaning excessive, and pnea is a suffix meaning breathing. Hyponia is a shallow or slow respiration. Hypo is a prefix meaning decreased, and pnea is a suffix meaning breathing. Hyperventilation is abnormally rapid deep breathing, resulting in decreased levels of carbon dioxide at the cellular level. Moving on, we'll now address lack of oxygen. In an airway obstruction, food or a foreign object blocks the airway and prevents air from entering or leaving the lungs. This is a life-threatening emergency requiring immediate action, usually by the abdominal or Heimlich maneuver. Anoxia is the presence or almost complete absence of oxygen from inspired gases, arterial blood, or tissues. The prefix "an" means without, the word root "ox" means oxygen, and the suffix "ia" means abnormal condition. If anoxia continues for more than 4 to 6 minutes, irreversible brain damage may occur. Asphyxia describes the pathologic changes caused by a lack of oxygen in air that is breathed in. This produces anoxia and hypoxia. Asphyxiation, also known as suffocation, is any interruption of breathing resulting in the loss of consciousness or death. Asphyxiation may be caused by an airway obstruction, drowning, smothering, choking, or inhaling gases, such as carbon monoxide. Cyanosis is the bluish discoloration of the skin caused by a lack of adequate oxygenation. The word root cyan means blue, and the suffix osis means abnormal condition. Hypoxia is the condition of having subnormal oxygen levels in the cells that is less severe than anoxia. The prefix hypo means deficient, the word root ox means oxygen, and the suffix ia means abnormal condition. Finally, respiratory failure is a condition in which the level of oxygen in the blood becomes dangerously low, or the level of carbon dioxide becomes dangerously high. Sudden infant death syndrome, also known as SIDS and crib death, is the sudden and unexplainable death of an apparently healthy infant between the ages of 2 weeks and 1 year that typically occurs while the infant is sleeping. This happens more often among babies who sleep on their stomach. For this reason, it's recommended that infants be put down to sleep on their back or side. But how do we know that you're having those issues in your body? Well, we're looking at the diagnostic procedures of the respiratory system next. Respiratory rate is an important diagnostic sign. The respiratory rate is counted as the number of respirations per minute. A single respiration, or breath, consists of 1 inhalation and 1 exhalation, and the normal range for adults is between 15 to 20 respirations per minute. Pulmonary function tests, PFTs, are a group of tests used to measure the capacity of the lungs to hold air, as well as their ability to move air in and out and to exchange oxygen and carbon dioxide. Phlegm is the thick mucus secreted by tissues lining the respiratory passages. When phlegm is ejected through the mouth, it is called sputum. Sputum may be used for diagnostic purposes. Bronchoscopy is the visual examination of the bronchi using a bronchoscope. The word root broncho means bronchus, and the suffix scopi means direct visual examination. This may also be used for operative procedures such as tissue repair or the removal of a foreign object. Laryngoscopy is the visual examination of the larynx using a laryngoscope. The word root laryngo means larynx, and the suffix scopi, means a direct visual examination. This may also be used for operative procedures such as tissue repair or the removal of a foreign object. Spirometry is a testing method that uses a spirometer to record the volume of air inhaled or exhaled and the length of time each breath takes. The word root spiro, means to breathe, and metry is a suffix meaning to measure. Tuberculin skin testing, TST, which is a screening test to detect tuberculosis, can be performed by the Manitou method, or the PPD, purified protein derivative. In performing the test, the skin of the arm is injected with a small amount of harmless tuberculin protein. A negative result, no response, indicate that TB is not present. A positive result, hardness within the testing area within 2 to 3 days, indicates the possibility of disease and should be followed by additional testing such as a chest x-ray and sputum testing. Chest imaging, also known as chest x-rays, is a valuable tool to show pneumonia, lung tumors, pneumothorax, pleural effusion, tuberculosis, and emphysema. So now that we learned what it is and how it goes wrong and how to check to see if it's going wrong, let's look at how to fix it. Up next is treatment procedures of the respiratory system. First, let's check out some useful medications. A bronchoconstrictor is an agent that narrows the opening of the passages into the lungs. A bronchodilator is an agent that expands the opening of the passages onto the lungs. At the first sign of an asthma attack, the patient uses an inhaler to self-administer a bronchodilator. Treatments for the nose and throat include septoplasty, which is the surgical reconstruction of the nasal septum. The word root septo, it means septum, and the suffix plasty means surgical repair. A sinusotomy is a surgical incision into a sinus. The word root sinus means sinus, and the suffix otomy means surgical incision. This procedure is used in the treatment of chronic sinusitis. Functional endoscopic sinus surgery, abbreviated FSS, is a surgical enlargement of the opening between the nose and sinus that is used to treat chronic sinusitis. Pharyngoplasty is the surgical repair of the pharynx. The word root pharyngo means pharynx, and the suffix plasty means surgical repair. A pharyngostomy is the surgical creation of an artificial opening into the pharynx. Pharynge is a word root meaning pharynx, and the suffix ostomy means surgically creating an opening. The resulting opening is called a pharyngostoma. The word root pharyngo means pharynx, and the suffix stoma means artificial mouth or opening. A pharyngotomy is a surgical incision of the pharynx. The word root pharynge means pharynx, and the suffix otomy means surgical incision. A laryngectomy is the surgical removal of the larynx. The word root larynge means larynx, and the suffix ectomy means surgical removal. Laryngoplasty is the surgical repair of the larynx. The word root laryngo means larynx, and the suffix plasty means surgical repair. Endotracheal intubation is the passage of a tube through the nose or mouth into the trachea to establish an airway. Intubation is the insertion of a tube, usually for the passage of air or fluids. Treatments for the trachea and bronchi include tracheoplasty, which is the surgical repair of the trachea. The word root tracheo means trachea, and the suffix plasty means surgical repair. Tracheorrhaphy means suturing of the trachea. The word root tracheo means trachea, and the suffix rhaphy means to suture. A tracheotomy is usually an emergency procedure in which an incision is made into the trachea to gain access to the airway below a blockage. Trache means trachea, and the suffix otomy means surgical incision. A tracheostomy is creating an opening into the trachea and inserting a tube to facilitate the passage of air or the removal of secretions. The word root trache means trachea, and the suffix ostomy means surgically creating an opening. Placement of this tube may be a temporary or permanent. The resulting opening is called a stoma. A stoma is an opening on a body surface. A stoma can occur naturally, for example, a pore in the skin, or may be created surgically. Treatment procedures for the lungs, pleura, and thorax include a pneumonectomy, which is the surgical removal of all or part of a lung. The word root pneumon means lung, and the suffix ectomy means surgical removal. A lobectomy, which is the surgical removal of a lobe of the lung. This term is also used to describe the removal of a lobe of the liver, lobe of the brain, or thyroid gland. Lobe or lab is a word root meaning lobe, and the suffix ectomy means surgical removal. A pleurectomy is the surgical removal of part of the pleura. The word root pleur means pleura, and the suffix ectomy means surgical removal. Thoracentesis is the puncture of the chest wall with a needle to obtain fluid from the pleural cavity for diagnostic purposes, to drain pleural effusions, or to re-expand a collapsed lung. Note how the spelling of the term. It is not a simple combination of familiar word parts. A thoracotomy is a surgical incision into the wall of the chest. The word root thorac means thorax or chest, and the suffix otomy means surgical incision. A thoracostomy is a surgical incision of an opening into the chest. The word root thorac means thorax or chest, and the suffix ostomy means the surgical creation of an opening. Finally, we'll identify a few different types of respiratory therapy. Supplemental oxygen may be administered through a nasal cannula or a rebreather mask to add more oxygen to the air taken in as the patient breathes. Postural drainage is a procedure in which the patient is tilted and propped at different angles to drain secretions from the lungs. A ventilator is a mechanical device for artificial ventilation of the lungs that is used to replace or supplement the patient's natural breathing function. The goal is to wean the patient from the ventilator and to resume breathing on his or her own. A respirator is a machine used for prolonged artificial respiration. For example, when a spinal cord injury destroys the normal breathing mechanism, the patient can continue to breathe through the use of a respirator. If you happen to find today's lecture especially exciting or interesting, then you may be interested in these career opportunities. In addition to the medical specialties already discussed, some of the health occupations involving treatment of the respiratory system include a respiratory therapist, abbreviated RT. Respiratory therapist treats patients with heart or lung problems by administering oxygen, gases, or aerosol medications under a physician's orders. RTs also use exercises to improve patient breathing, perform diagnostic tests, and connect and monitor ventilators. Respiratory therapy technicians, RTTs, works under the supervision of an RT to administer respiratory treatment, perform basic diagnostic tests, clean and maintain equipment, and keep records. Hopefully today's conversation stimulated some interesting questions. Perhaps you were wondering why we need oxygen to live, or why is a yawn contagious? If you still have those questions, bring them to class the next time that we meet. Thank you so much for viewing. Make sure you like and subscribe, and we'll see you next time. Until then, be good people and do good things. Thanks, and we'll see you later. Bye.